You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. In today's episode, I want to talk to you about one of the more common questions that I get asked from a lot of my knee patients, and that is whether or not they're a candidate for a partial. So what is a partial total knee replacement? Well, a partial knee is just that. It's part of the knee being replaced. So when we talk about parts of the knee, we're talking about compartments, and there's three main compartments. There's the inside compartment called the medial compartment. There's the outside compartment called the lateral compartment, and these are two places where the thigh bone and the shin bone meet or intersect and rub on one another. The third part or third compartment is called the patellofemoral joint, and that's the spot where the kneecap hits and rubs against the end of the thigh bone. And you can actually replace any of these one parts. And some of the original total knee replacement designs were actually just two partials. So nowadays you have total knee replacements, which replace all three parts. So you have the kneecap portion, which is replaced most commonly in America. Other countries sometimes will keep your normal cartilage if the cartilage looks perfect. You will resurface the end of the thigh bone with metal and the top of the shin bone with metal and plastic typically. And when we do a partial, what we're doing is you're addressing just that bad cartilage in one part. So for instance, if you're doing a medial compartment, what you're doing is just shaving off, removing, or burring down a small portion of the cartilage on the end of the thigh bone, taking off some bone and cartilage on the top of the shin bone and replacing that with metal and plastic, and then maintaining the rest of the knee, the ACL, the PCL, the outside or lateral compartment, and the kneecap joint. So the good and the bad. If you have arthritis in more than one part of your knee, you have to understand that when you do a partial, you're only going to fix the problem in that one part of your knee, and you are going to continue to have symptoms in that other part of the knee. And also, as we age, we're at risk of developing arthritis. So there always is that chance that if you put a partial in today, even though you don't have any significant arthritis in the other part of your knee, you may develop some arthritis on that other part of the knee. And if it becomes significant and severe, you now may need a second operation to go in and remove the partial and put in a full knee replacement. Now, years ago, that wasn't really thought to be a bad thing because we always felt that the results of that knee replacement, when you did it to revise or after a partial knee replacement had failed, that knee replacement was as good as a knee replacement that you were putting into a virgin knee. But what a lot of studies have now shown is that every time you do a surgery, that second surgery is a revision, third surgery is the second revision. The more surgeries that you have, the greater the risk of problems with scar tissue and pain and stiffness and other symptoms. So what we now know, though, is even if you just do a partial and then you convert to a total later on, that total is never as good as the first total would have been if you put that in the first place in that virgin knee. And, how long they last is always a big question, too. So, when you look at studies, and depending on what study you read, you may see some variations in these numbers. But, for a lot of people, a partial knee replacement is functioning 90, 92% of the time, 8, 10, 12 years from the day it was put in, where a total knee replacement may be functioning 90, 92% of the time at 20 or 25 years. So therein lies that big dilemma when people have the option. They have to look at their quality of life and how long they're planning on living or how old or young they are. And they're trying to decide, well, what's the chance that I might need a second operation? And if so, that's going to be when I'm 10 years older than I am now. Do I just want to have a full knee replacement? And there are some people that are sort of in the middle. They're on the fence. They're on the margin where both may have reasonable choices to make a decision for a partial or total, and you're trying to decide. The other thing, though, is you may actually find surgeons that are pro-partial or pro-total. I'm definitely one of those surgeons that's a little bit more pro toward the total side, because I know that by doing that, I can do it well, and I'm going to eliminate the chance of arthritis in another compartment. And I'm also going to eliminate that chance of them having a partial, having it not work well or fail, and needing a second operation, which may lead to an inferior outcome. Where some of my friends and partners and other people that I know are pro partial. So they would prefer to keep as much of the normal native knee as possible and put the partial in, understanding that if their indications for patients are open, and they may take some people that are great candidates and some people that are questionable, they may have a number of people that early on have a revision at 1 or 2 years because they're still not happy with the outcome. Now, when I do have patients that have a partial on one side and a total on the other knee, they will always say that the partial knee feels more like their normal knee. Well, why? Because it is still more of your normal knee. You still have two compartments that are yours. Ligaments are yours. There's more what we call proprioception. So you have a sense inside your knee with pressure on the cartilage meniscus of kind of where your knee is in space. So they all tend to like that knee better since it feels more normal. However, if you have someone that's gone through a partial and a rehab, and they're still not happy and they're still having pain, now they're looking at one surgery, one rehab, planning on a second surgery, second rehab. That's the patient that tends to be very unhappy and always kind of wishing I would have done the total in the first place. But again, nobody has that magic crystal ball, and everybody, hindsight is always 20/20. So it used to be that partials were best for young, active individuals in the hopes that we were delaying the need for a total knee replacement. There's also a good indication for older individuals that have very isolated disease, such as something we call osteonecrosis or SONC, spontaneous osteonecrosis of the knee. So if they have very isolated arthritis, one compartment, or this necrosis of the bone, the rest of the knee is normal, you can get into a partial, and a lot of those people do well. Some relative contraindications. So patients that are large, obese, more overweight individuals will put more stress on a partial, and there's a greater risk of it fracturing the bone underneath it, or what we call subsiding, where the bone just can't support the weight of the implant and it collapses underneath itself. The other indication is sort of a relative indication for some implants and a contraindications for other, is the use or function of your ACL or anterior cruciate ligament. So some implants require the ACL to be there and functional. Some it's questionable. There are actually some doctors that will do an ACL reconstruction and a partial all at the same time in the appropriate individual if the rest of the knee is perfect and pristine. So there are all those sort of options and possibilities. Next thing, people always want to know, well, isn't it a faster rehab and isn't it less pain? Well, yes, a little bit, and studies will show that the recovery at a year, I don't see any difference in my patients. 6 months, you don't see much of a difference. You see a little bit of a difference in the beginning. First 6-8 weeks, the partials tend to be, a couple weeks ahead. But the reality is nowadays that, most total knees and partials, some places are done as an outpatient. Most places, it's a one-night stay. This is different than when you were in the hospital for 5 or 7 days. So the time in the hospital or time to recovery, we're talking small changes, small decreases in pain. It's not that it's painless or pain-free. It's not a super easy recovery. Some individuals do have a hard time, but it is a little less painful. It is a little shorter recovery. And what is known, though, is it definitely feels more like your normal knee. But if you do have arthritis in other components and you have symptoms in other parts of your knee, you're probably not going to be happy with the outcome if you relieve only a portion of your pain. So that hopefully gives you some insight into the idea of, are you a candidate for a partial total knee replacement, or do you need a full knee replacement? Obviously, this is a discussion that has to be held with your surgeon, and it's based very intimately on your exam, where your pain is located, what the stability of your knee is like, what the deformity of your knee is like, and what your x-rays look like, to make sure that you're making an appropriate choice into what surgery you may need if you're going down the route of surgery. So thank you for listening. This has been the Your Knee, Your Health podcast. I'm Adam Rosen. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.